Hello and greetings and good afternoon. It's a nice warm afternoon here in Houston. And I know I haven't been on in a while. I've been traveling a little bit lately, but I want to share a topic that's pretty important to me as a cardiologist, and it's about hypertension. We see lots of people with hypertension in our clinic. And most of you who follow us on the station know that we have been following the health conditions of a number of athletes and entertainers who've suffered from either coronary disease or reported histories of stroke. And later today, I'll be talking about the late, great Tina Turner, who recently passed. And she suffered from a number of chronic illnesses, and I'll give you some insight to that. Today, what I want to do is share with you some tips about hypertension. And hypertension is a very common disorder. It's one of the most common disorders, dysfunction in cardiovascular disease. It contributes to heart disease, and many of my patients who come in with heart failure or coronary disease, who've had heart attacks, many of them suffer from hypertension. Individuals who are on dialysis frequently have a combination of hypertension and diabetes. So I think this topic of hypertension doesn't get enough attention. However, my approach today will be to talk about three key steps to control your blood pressure. So hypertension, it shouldn't be the monster that it is, but here are three key steps to controlling your blood pressure. So first and foremost, I want to talk about what is hypertension. There's some basic things you simply need to know. Hypertension is simply high blood pressure, and it's when your blood pressure is over 140 over 90 millimeters of mercury. That's the upper number to systolic blood pressure, the lower number to diastolic blood pressure. Above this number is hypertension. If you get consistent measures above this measurement, above this number, then you very likely have hypertension. Now, certain conditions can cause your blood pressure to go up if you're stressed, if you haven't slept well. So you can get various measurements that are elevated spontaneously. But if most of your blood pressure measurements, of all your measurements, are over this number, then you likely have hypertension. It's common but serious if it's not treated. People with high blood pressure may not feel symptoms. That's the problem with hypertension. We call it the silent killer because individuals may not feel symptoms. You may not feel chest discomfort. Sometimes people get headaches, but you may not feel symptoms with hypertension. Now, what are some basics? But before we go to the basics, I want you to like, subscribe, and share this video. For those of you new to the channel, share. And of course, don't forget to hit the notification button. We have lots of educational videos coming, and I've got some new show content that I'm developing now that will be moving out in the next few weeks. You're going to love it. We'll be announcing that pretty soon. So how to begin correcting the blood pressure. Those of you who don't have time to watch the rest of this video, here are the basics, cut to the point right here. The basic steps: 1, hydration and fasting. So if you find that your blood pressure is elevated, let's say you haven't been to the doctor in a while, you find that your blood pressure is elevated, and you find that you can't get an appointment for several weeks or a month or two to see your primary care physician, these are the things you can do. First of all, start hydrating. Okay, drink lots of water. The best water is either alkaline water or distilled water that's infused with green algae or spirulina or organic greens. Start a time-restricted eating pattern. This is also known as intermittent fasting. Start eating at 11 a.m., your last meal at 4 a.m., nothing in between. Exercise. Start off with walking. Okay, you don't have to start rigorous exercise. Go for a walk. Start with a block, start with 2 blocks, 6 blocks, a mile, half a mile, whatever. Start walking on a regular basis, stretching, mild strength training with push-ups, dips, squats as your fitness level allows, and high-intensity interval training over time. But walking is a good first step on the exercise. And optimal nutrition. Remove all animal protein and processed foods from your diet. Start with the raw plant foods only, at least for the first 15 to 30 days, and consume these foods between 11 and 4. you start these basic steps, you'll start to notice your blood pressure coming under control within the first few days. Of course, always seek medical attention. However, while you're waiting to get your doctor's appointment, these are some basic lifestyle steps that you can take. So the basics are the basics. Now, frequently we have patients come to office with advanced, hypertension. They have, issues related to their blood pressure, such as, the blood pressure 200 over 100. They may have chest pain sometimes. They may have kidney problems. They have other issues, diabetes. So sometimes there are complexities along with high blood pressure. So it's not always simply just high blood pressure. However, even in our practice, we can apply the same basic steps that I recommended that you start at home. However, we apply it in a much more complex manner, and we have more supportive tools. So let me share with you how we apply these same basic steps, but we do it in a more natural way, but it's slightly more advanced because we apply it in what's called an integrative health program. So at Montgomery Heart and Wellness, yes, we apply basic lifestyle integration, but we do it in an integrative manner. So what do I mean by integrative health? Integrative health starts with a combination of allopathic medical therapy. So I'm a board certified cardiologist. I can write prescriptions. I can manage patients' medications. However, I don't just stop there. I use natural and regenerative therapies to help in terms of helping patients stabilize their condition. So the allopathic approach, we may adjust medications. We may either reduce some, increase others, but we help stabilize the person's condition. We use state-of-the-art medical diagnostic therapies, echoes, stress, all these things, blood tests to evaluate the patient's clinical condition. And once we confirm that they're stabilized, we start weaning prescription medications. We integrate this in a natural lifestyle integration approach, enhancing that natural healing. Lifestyle enhances natural healing. Medications essentially treat symptoms. We utilize target micronutrients. We utilize advanced regenerative therapies. These examples include sauna therapy. We also have ultraviolet light therapy. We use ozone infusion therapies, external counterpulsation therapies, hyperbaric oxygen therapies, and the like. Some future therapies will include stem cell therapy as well. So there are advanced things you can do in addition to these basic lifestyle interventions. However, the lifestyle interventions have a very major impact, can have an impact very quickly. So we see changes very quickly with patients. So let me share with you one of our overall approach. So fasting, cleansing, we have classes that advance recipes. We have a chef and a kitchen and a nutrition center and a restaurant in our health center. We use integration of this along with IV infusions, oral supplementations. We also have trainers on standby for fitness classes and exercise. We have online coaching, and also we refer patients for things like acupuncture and other types of therapies. We do IV infusions, as I mentioned before, external counterpulsation for patients with heart disease. So all of these integrative approaches are utilized in addition to stabilizing the patient, and all of this is utilized in an integrated fashion. We call it our Heart and Soul of a Champion program, where patients benefit from all of these. Oftentimes patients will try to get supplements from over the counter. They don't know what they're getting. Our supplements are from a center where it's tested. The ingredients are known. They're not lots of fillers. We know what the ingredients are. We know what the quantities are. And it's in a qualified lab that meets meets FDA standards. So here's a situation where the patient came to us and he did not know he had hypertension. He was coming for a cardiac evaluation. He wanted to improve his health. And here's what we did to help him out. First and foremost, this was a 62-year-old man. He was a retired NFL athlete, actually a well-known athlete. You'll probably recognize him. He had not undergone a medical workup in about 15 years. It might have been as long as 20 years. He didn't remember. He had a reported history of hypertension, but he wasn't taking his blood pressure on a regular basis. He knew he had a family history of hypertension. He did not have any symptoms. In fact, he was pretty active. He played with his grandkids. He showed me videotapes of him doing cartwheels with one of his grandkids. However, when we took his vital signs, the initial blood pressure is 191 over 114. And so that raised all of our eyebrows. So this was a situation where number one is decision time. Okay, what do we do? This is a very high blood pressure. Do we send him to the emergency room? Okay, many doctors will send patients like this to an emergency room. Do we start them on medications? That's certainly the indication. Blood pressure that high, it's certainly reasonable to start someone on medications. How about a lifestyle change? Can we start them on, raw fruits and vegetables, or a nutritional detox regimen, a juice feast, or something like that? That's certainly an option. Certainly within our clinic, it's an option. So let's discuss, what decisions we made and how we came about making this decision, because I think it's important to understand that making these decisions can be very, very, critical, and how you go about making these decisions is important. So lots of thought goes into this. And so what I'm going to do is I'm going to bring you into our clinic and show you what we did, how we went about making our decision for this particular patient. Watch and see. Let's look at Mr. Green's stress test.
On his stress test, he had good functional capacity, went for a good period of time. His blood pressure response was normal. It started at 191 over 114 in the office, and then after the end of the exercise, it was 180 over 100.
Okay, that's pretty good. And EKG changes, anything? Let's kind of scroll through the EKG stress real quick. So one, even though you had a very high blood pressure, there was no evidence of any stress on the heart, a heart attack going on, which is important. The stress test didn't show any changes consistent with ischemia. What should we do? I mean, blood pressure 191 over 114, a lot of people send them to the ER right away. Okay, so there you go. As you can see, we analyze all of this testing. So if someone comes in with an elevated blood pressure, we have the tools right there in our center to evaluate an echocardiogram, evaluate blood work, to see how he performs on a treadmill stress test. Now, many doctors will not exercise someone with a blood pressure like this. However, this individual said he had been exercising to a certain extent, not rigorously, but doing cartwheels and walking in. So we start him on a treadmill. The treadmill is walking, not running. And so we monitor his blood pressure very carefully and see how his blood pressure responds. This is diagnostic information that is beneficial to us. So all of this goes into our decision-making process. We don't just look at, the blood pressure's high, let's put him in the hospital, call 911. No, you have to think, you have to analyze. So what was our decision-making? So you always have to look at the pros and cons of what should be done with a patient. So what should we have done with this patient? Okay, well, their benefits of going to the emergency room, what are they? There's inpatient observation. You can normalize the blood pressure. Go to the emergency room, give them some medicine right away, get it down right away. Rapid normalization of blood pressure, more rapid results of blood tests. You can get blood tests and get it within an hour or two. So these are benefits of going to the emergency room, and there are other benefits as well. However, there are negative sides of going to the emergency room, okay? There's an extra cost. Now, we don't want to just think of only costs when it comes to someone's health and well-being, but that's nothing that's trivial. There's an emotional stress related to going to the emergency room, which can make the blood pressure worse, okay? And sometimes you can have iatrogenic causes. Iatrogenic causes mean medically induced causes. So he can go to the emergency room and get a medication, and the blood pressure can be dropped too soon, or some other type of health-induced problem could make things worse. So many people go into the emergency room, get infections, various other things. Plus, oftentimes the emergency room, he may wait for, 12 hours or 6 hours or some ridiculous period of time before he's even treated. in our center, we were able to evaluate him within a much quicker period of time than that. So, there's not always a quick approach to this, either or. It's not saying, well, oh, blood pressure's high, automatically to the emergency room. No, we always have to think and analyze. Is the patient stable? Are they having symptoms, et cetera, et cetera? So I'm curious to find out what you would do. So please enter into the chat what your decision would be in terms of whether you would send this patient to the emergency room or not. Now, many of you are medical professionals who are watching this channel, so I'm curious to know what your thoughts would be. We took another route, and so what we did, we applied an immediate nutritional detox on this patient. Here's what happened. His systolic blood pressure started at 191. Within a few days, was down by 41 millimeters of mercury. In about 11 days, it went down to normal. The peak diastolic, the average systolic blood pressure, averaged around 167, and it was down by 30 millimeters of mercury in about 5 days, and down to normal in about 11 days. Diastolic peaked at 114, was down to 91 millimeters of mercury within about 5 days, down significantly in 2 to 3 days, by the way, and essentially close to normal by 11 days. Average diastolic blood pressure similarly went down to normal within 11 days, down significantly in just a few days. So with a nutritional detox, just as I described earlier in this program, this person had a very rapid correction of blood pressure, and we did not start him on any medication. We saw him every day in the clinic. Now that's, maybe it's the downside for some people, maybe it's not. But we've monitored him very closely. We had blood work. We had results of blood work the next day. And so we were able to monitor his condition. We felt very confident that he would do well because he came in without any acute symptoms. We monitored his heart, EKG. There was no evidence of acute cardiac event going on. So we felt that his clinical condition was stable enough to where we can then introduce this detox. And we knew that he would be compliant because he expressed that he was very willing to be compliant with the aggressive nutritional detox. And over 11 days, he had a very significant reduction in weight. And in 30 days, his blood cholesterol levels that were elevated went down very significantly. So this is an individual who had very positive outcomes. Heart rate came down in 2 to 3 days. His systolic blood pressure, diastolic blood pressure came down in 2 to 3 days. Heart rate came down in 2 to 3 days. And we lowered his cholesterol, glucose, and lipoproteins in about 4 weeks and had significant weight reduction in this time period as well. So this is a situation where we saw an individual, and as you saw, we sat down, we went through his labs, I met with my clinical team, and we went through everything. We were very careful in our approach, in our thought process, and we were able to apply this natural nutritional intervention in this individual very acutely. I want to introduce you to Heart and Soul of a Champion. It's our integrative program that we use, but also we have a docuseries. Heart and Soul of a Champion is a docuseries that we chronicle the life and health journeys of many individuals coming to our center. Not only can you see the rest of the story with this individual, but you can see other individuals who come with heart disease and cancer and many other illnesses, men and women. We have season 1, which is released. You can go to our website, heartandsoulofachampion.com. It's in the notes section of this video, heartandsoulofachampion.com, and you can see the web page. Also, you can see the trailer for the first season, and you can also download and purchase the first season and watch how we go through our integrative approach with these patients. So anyway, thank you for your attention. And remember, like, subscribe, and share, especially if this is your first time to the channel. And also share this with many individuals, loved ones that I think would benefit from this. And stay tuned. Later today, I'll be talking about the late, great Tina Turner. And as I typically do, I describe their life to a certain extent, but I'll highlight the health conditions and what aspects of her lifestyle contribute to her health conditions. And then we'll talk about how you can make changes in your lifestyle to avoid these similar type health conditions. Until next time, Take care, and I look forward to seeing you in the next video.